Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shailinder, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 a.m. Radio that listens to you. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
Good afternoon, folks. This is Dr. Shailinder Sodhi on the show Your Body is Your Natural Pharmacy. I'm along with my wife, Dr. Anju Sodhi. We both will be both will be discussing your infertility issues in this show today. I apologize for this little bit fumble in the beginning, but it's been a few weeks I've been back on the show, so it takes a little while to get used to the microphone and to the radio station. So anyway, Dr. Anju, you will be discussing about the Ayurvedic part?
Yes, hello. I'm glad to be back on the show, and we will be discussing on the fertility. And please bring your questions if you have any.
So in this show, you can also call us in the native language in Hindi, Punjabi, Urdu, और किसी भी भाषा में आप हमें कॉल कर लें जो भी ये भारतीय मूल से हैं. मोस्टली हम हिंदी, पंजाबी, उर्दू में बड़े आसानी से बात कर सकते हैं. तो आप हमें फ़ोन करने के लिए 1-844-301-1250 पे कॉल कर सकते हैं. 1-844-301-1250 on Desi Radio 1250 AM. And we are discussing today infertility in men and women. And this is usually a very sensitive subject because this is one of the things which can make or break the relationship or sometimes create a, kind of disharmony between the relationship or in the family. So, when we discuss these type of issues, we have to be very sensitive to understanding the couples who are suffering with this problem. So, Dr. Anju, you have seen quite a few of these patients, and I have seen my share of patients.
Yes.
And, usually what is the most common thing you usually find in the couples when they come in and they're telling you what they're facing in the trying to get pregnant?
Yeah, like most of my women, like I have seen that polycystic ovarian syndrome, which a lot of people are now aware of too. So is very common in the women these days.
It's one of the cause of infertility. And similarly, I have seen in the men issues too, and there are about 13 out of 100 men. That's about 13% of the population in men who are also having an issue. And when that combines, recently I saw a case in my clinic, in our clinic in Bellevue, that where couple both are the tough cases because husband also has an issue and with the wife also has an issue, and she has been gone through the PCOS, and also there is an issue with the surgical scarrings from the other reasons in the pelvic areas. So that has caused quite a bit an issue, and this couple is not able to conceive. So anyway, like folks, over 1 million people women suffer with the infertility in the United States, and most often the cause of the infertility is the pelvic infection, endometriosis, and certain pelvic surgeries like Dr. Anju mentioned, the PCOS, And I see lots of hormonal
imbalance, a lot of hormonal, and the PCOS is the one of the cause, like due to the hormonal imbalance as well too.
Yeah. So PCOS can be for other reasons like autoimmune issues, and that's another issues which we find. And these issues generally, what I find in fertility cases are basically there is some sort of a stress involvement in the life.
Yes, definitely stress, and women are these days mostly working too, so that also put impact on the fertility too. And like a lot of my female patients, like they are in the IT, and I think like they waited for too long or for any reason, so at this time like they are not able to conceive. So that is another factor.
So the age factor is usually one of the things which we find is an issue too. Usually, the best fertile age is, we said, before 35.
16 to 35, according to the Ayurveda, that is the best age.
Right, and in my understanding, I consider 16 to 18 is really a very young age, where 35 and over is a little bit, we are pulling the strings too far. It's usually not, I think, if somebody who wants to have a babies, they should start considering mid-20s.
Mid-20s, yes.
Because that's where we have good genetic pool, good DNAs, and eggs are strong, and sperm counts are strong. So, those are the things which I think majority of the population need to understand when we're discussing infertility. If you want to have family, and if you're ready to have a family, not to delay too far.
Not to delay too far.
And, we have a caller on the line. Caller, this is Dr. Shailinder Sodhi, and you are on the show, Your Body's Natural Pharmacy. Please go ahead.
Hi, Dr. Sodhi. This is Kate Colvin.
Hello, Kate. How are you doing?
Good. How are you?
I'm very well, thank you. And thank you for calling us. Today we are discussing infertility, and I will take your question. And just tell me, what is your question, Kate?
Oh, well, I was just curious as to what kind of supplements or what you can do, maybe even with diet when you're facing infertility or trying to get healthy and prepare your body for pregnancy.
That's a very good question, Kate. And that's a question which I tell all my patients, that your body is what you put in it. So, it's the supplements and having clean diet and a healthy diet. We call in Ayurvedic medicine is sattvic diets. The pure diets are very much recommended when it comes to the infertility or increasing the chance of getting pregnant. So when it comes to the, some women who are planning to get pregnant, basically they need to make sure their diet is wholesome. It covers all the concept of complex carbohydrates. It's also have beans in it, which give some proteins and complex carbohydrates, along with fish and, the proteins from the fish source and the chicken. Though I always tell my patients, if you're going to eat a fish, make sure it is coming from the clean waters, because mercury is an issue, especially with the tuna fish. So, having that type of diet will definitely increase the reserves in the women as well as in the men. We want to make sure that you only have that set number of eggs available, and also the fertility, like we mentioned, is upbeat up to the certain age, and once we say that once you cross 35-40 years, your getting pregnant chances go down. So also during this is the time when women who are 35 or over, we start seeing in that there is a chances of getting neural tube defects. So for that reason, we find the folic acids and B vitamins are very helpful. So women must be taking lots of folic acids, especially 400 microgram minimum per day.
And according to Ayurveda too, like the preconception time, like we have to prepare the body for the pregnancy too. So it is very important that all the minerals and the vitamins and the calcium, along with the healthy diet, is also very important.
And one of the things which we do, Kate, is also recommending, there is a ritual we call before the couple who wants to have baby. We said there is a ritual. The ritual is like we need to make sure both husband and wife are eating healthy, they have a good relationship, they're enjoying the life, they have that harmony in their house, in harmony in the bedroom, and creating that. And also on top of it, we consider detox. And Dr. Anju, the detox we consider usually.
Cleansing is very important, especially for the women who are trying for at least for a year and they are not able to get pregnant. Then we need to think about the cleansing, because there could be, like as I said, the PCOS I'm seeing in my lot of my patients is very common these days. So that is like the excess estrogen into the body too. So we need to cleanse that. We need to do that deep cleansing through the Panchkarma, which is the detox program we do at the office.
And also when we talk about estrogen dominance or the estrogen coming, we need to make sure all the parts and pans are clean. We are not using too much of the plastics in our, not microwaving these food with the plastic pan. All those things we need, and also make
that also impact. And the eating fresh, not eating the frozen foods, and not eating the like the old food is very important.
Right. So the frozen food, out of the shelf is not recommended. Eating right from the fresh food and cooking food for yourself is good thing. So Kate, these are the general recommendation which I recommend to my patients. So also beside, these are not the only thing. We need to pay attention if body's physiological hormones are in harmony. That means the estrogen, progesteron, the thyroid hormones, the follicular stimulating hormone is, they're not stimulating. If the FSH is too high, that indicates that the ovary reserve is kind of dwindling down. So there is not much ovulation. So these type of things need to be really paid close attention. So I really thank you for calling and asking us a great question.
Oh, thank you so much. It's very informational.
Thank you for calling us.
Thank you so much. Have a good day.
Yeah, you too. Bye-bye. So, folks, like I mentioned, it's such an important issue that when we talk about infertility in women, like Dr. Anju mentioned, majority of times, about 10% of the couple in the United States are affected by the infertility. And both men and women can be infertile. I find like 13% of the men mentioned, I earlier mentioned.
Yes, many times like we do not pay attention. We are trying to treat the women, but like sometimes the men has the denial factor too. And I have seen that in my women patient that they do not want to come and see the physician.
My standard rule of treating infertile is that I want to see husband-wife. I always say, okay, I'm treating you, ma'am, but I also need to see your husband.
Which is very important.
Because I need to see what type of relationship they have at the end of the day. Because if they don't have that good relationship, it is body's denial, not acceptance. If you are not emotionally accepting it, body can reject it. And even though, can you believe the amount of all the infertile patients, those who have been trying for over a year and not been getting pregnant? That's when we say that, there is some issues going on. You have been trying actively and you have not been able to conceive for a year. Let's start thinking about work. About 20% of those cases are totally normal.
Yes.
And that 20% of population has no reason why they cannot be pregnant. And these 20% of the population, I always say, I want to treat you and as well as your husband or wife together. Because this is the 20% of population which has some issues at different level.
Yes.
And that level is
and
usually...
also the stress plays major role in these type of patients, like because they are working overtime and they are not they are not there for each other.
They are not spending
time with each other. And then same time they are planning on if they are doing the family planning, and that's not happening. There has to be some reasons. If there is not any physical, we can find anything.
So I find funny, there was one couple came to me and we have done everything. I found that, wife was totally healthy. There was nothing wrong with her. She was having regular cycle and her ovulations were normal. And, perfect. And age group was within under 35. And husband was also totally normal. Their sperm counts were normal and they were just not able to. So my treatment protocol was very simple. I said, both are very healthy couple. I think you need a break.
Yeah.
I said, why don't you go and take a vacation? So that simple, giving them a normal break from their normal time ritual, the amount of work they were doing, the husband was going early in the morning, like 4 o'clock, and coming home late evening. Wife was going and working into the high stress jobs, and so they did not have enough time for each other. So when body sees that you are physically not ready, it's not going to conceive.
It's not going to conceive. Yes.
So that's one of the things we need to make sure that couples understand. Folks, we will be just taking another break, and we'll be right back with your questions. And feel free to ask us in any language: Hindi, Urdu, Punjabi, or English. We are here to answer your question. Thank you.
If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information.
Okay, thank you, folks. This is Dr. Shailinder Sodhi on the show Your Body's Natural Pharmacy, and we are discussing infertility along with Dr. Anju Sodhi. So, Dr. Anju, some of the things which we look into in Ayurvedic medicine, in the infertility, can you please discuss some of those issues?
Yes. According to the Ayurveda, there is the 4 essential components that has to work together optimally. And that is, one is the timing, second is the field, and the third is the fluids and nutrition, and fourth is the seed, which is beach. So according to the timing, like these days, everybody's, mostly couples, young couples, they are saying, are we ready? That is their first thing. Like, I think in the old time, it was, timing was not that important. But these days, because husband and wife both are working, so timing is very important.
So what are you saying is, when you're saying about timing, I think it's the people have to also make sure that they're ready.
They are ready for it.
You cannot have two types of thinking. No, we probably want to have wait. These days, couples are getting married late too. I mean, majority of age population, I'm finding they get married at the 25 to,
yes,
to
because
30.
Girls and boys both are professional, and the girls at marriage age is about 26, 27, or maybe 30.
Right.
So they cannot wait very long, but at the same time, they want to see if they are ready for the child. So timing is very important in that case.
And emotionally, I think the timing is such an important factor, because like I mentioned earlier, that your reserve pool, the eggs, those are much more available in the younger age, and they are a very healthy quality too.
Yes.
And so these people are the one who can get pregnant easily during this. So timing is important. And timing of the year, I think.
Timing of the year is very important too.
As well.
Because the spring season, it is, and as we all know that spring season and everything is it's like after the fall, it's everybody
winter
loves after the winter, like everybody loves the spring. And
so it's like everything is growing around. Like spring, we see the plants are coming, the birds are chirping, chirping. It's just in one way of natural way that our bodies also can not only recycling but also rejuvenating during this time.
Yeah, and the juiciness of the spring replaces the dryness of the winter. And
right.
This is the best season too, according to Ayurveda too, to conceive.
So the springtime, folks, is that we have more actually cells producing in the body than any time of the year.
So, what is the optimal for the, if couple is stable in their life, they don't have a lot of responsibilities, it's more optimal. But like the non-optimal would be like if they have a lot of responsibility, they have stress, they have financial stress. So those factors will tell them not to conceive yet. So Also, if they are spring season is best season, and also other thing is if the woman is having the regular menstrual cycle or not, if there is the lack of ovulation or the skipped cycle, so the timing is not right. So we need to work on that.
Right. So timing is so important, not only because of the way the cycle happens per month, but also the timing is so important that the fertility decreases by 3 to 5% after age 30.
Yes.
So
yes.
That tells you when somebody, I have seen some couples coming to me at 40 and mid 40s, they want to, all of a sudden they have changed and now they want to get pregnant, they want to get help. So, I mean, that is delaying, you already have delayed the clock.
Yes.
So, it is important, the call, which in Ayurveda we call the timing, is so important that, and the time of the year when we want to, is also important.
Also important. So, the second thing would be like in the 4 components, like the field, the kshetra. So that's like for the women, if they, like I mentioned earlier, like I see a lot of patients with the PCOS too. So if they have the PCOS, there is excess estrogen, and also like if they have endometriosis or the fibroids. So so that will be, all the factors will is in they are not able to conceive due to those factors.
Right, and I see lots of endometriosis cases, and personally I've seen so many, and there is a lot of scarring. And the folks, those who do not understand what endometriosis is, it is the lining which grows inside the uterus, and this is called endometrium. In the endometriosis case, what happens, this endometrium grows outside of the uterus, and it can attach itself to the ovaries or even part of the intestine to the fallopian tubes, which can interfere with the fertility factors and also cause the scarring in the tubes.
In the tubes. And it's secondary to the hormonal imbalance, because the women doesn't have the regular menstrual cycle, or the hormones are not balanced. And so those are the few, we need to correct that. So we need to work on that, if that is the one issue too. So that is the second, the timing, the field. And so for that, we need to, at the Ayurvedic clinic, we do a lot of with the herbal supplements and the detox diet, and also with the Panchkarma, we try to make it more balanced.
So basically what we do actually is we look at the whole picture. I mean, we do the complete panels. We also make sure that, the hormones are in sync.
Yes.
And a lot of time it's just bringing the hormone into balance, along with the, also the overall health improvement by trying to getting them certain supplements and vitamins, and also improving the diet factors, and de-stressing, teaching how to do certain yoga postures and breathing exercises. Those are the factors which really increase the chances of getting pregnant. So it is like when we're talking about the endometriosis or the pelvic infections, these are the things which can really damage quite a bit to the fallopian tubes. To our listeners, fallopian tubes are the tubes which actually are attached to the ovaries where the eggs are, and it when the egg is released, it travels through the fallopian tubes to the uterus, and that's where it attaches if it gets pregnant. So if there is a damage to the fallopian tubes, usually that will cause a scarring, and it can interfere with the pregnancy. And so one of the things which I think we consider is the lymphatic drainages and massages and detoxification, which is part of our Panchkarma.
So the third component is the healthy and nutritious fluids. So when we talk about that, so it comes into the mind like the plasma, the lymph, and so that has to be the balance. Like if a woman has the more the anemia, fatigue, lack of energy, so it's they are not able to get pregnant easily.
It's just body telling you you are not ready.
Telling you are not ready.
Getting pregnant is a lot of load on the body. It's a huge burden on the body's physiological system, that it needs to really be ready in every field.
Yeah, and if they are dehydrated, the women or even the men are to the overwork or for any reason, like the dehydrated or the dryness or the palpitation of those type of issues can interfere too.
Right. So that's one of the things which we recommend. Make sure you hydrate your body enough, and you're hydrating with not only water but also making sure whatever other drinks you have are quality drinks, not the carbonated drinks or the sugary drinks, which do interfere with this factor.
Yeah, and these days, like which in our clinic we find that diet is not good into our population these days. Like people are eating more frozen foods or the fast foods, or that also interfere, because that's not nutritious and that's not going to help either.
Well, the standard American diet we call is not a really good way of living the healthy body, but it also interferes with the factors which are needed to have a fertile couple.
Yes, and like if we are talking about the organic, it's very important to eat the pesticide-free diet, and also with the if people who eat the fish or chicken, many times I need to tell the wild fish is so important to eat, and people say that they eat fish, they eat salmon, but they have no idea. It's farm raised, or they are a lot of people, the tuna is one thing, why you are stopping us to eat tuna, and because it's heavy in the mercury toxicity. So there is lot of factors need to be
these are the one factors, which I think the other factors which also we need to see is when we going for the fruits and vegetables, that how important it is to eat clean, right?
Yes.
Because all these chemicals which are sprayed are actually damaging to the sperms. They're also damaging to the ovaries and also damaging to the ovum, so the eggs. So that's really is not some of the things which we recommend our population to consider at all. When you eat clean, we say eat completely clean.
Yes. And the fourth component is the seed, which is like the egg and the sperm. So egg and the sperm, as we mentioned earlier, according to Ayurveda, it's the age 16 to 35 is the best age. So extremely young or extremely old age would not be helpful.
Right, and one of the things which we say, if you are, the aged men probably do not have enough good amount of sperms, or the sperms which are active, because in population, in the journal, when we're looking into the sperm counts, it varies from 15 million to 150 million in calling it to the natural. So the one of the thing which we need to make sure that these populations understand, the sperm counts go down as we age. Yes. Same is the eggs as it goes down as they age. So we have a caller on the line. So caller number one, you can go ahead and ask your question. This is Dr. Shailinder Sodhi on the show Your Body's Natural Pharmacy.
I was actually a patient with the doctor. About 4 years ago, I started seeing him. I had thyroid issues and hormone imbalances, and the Western doctors couldn't diagnose me. We've since had our first child.
Wow, congratulations. I think I remember that, it's such a basic thing. When I think you came, we looked into your overall the lifestyle, we paid attention to your diet and nutrition and what were the stressors in your life. And along with when we looked into the hormonal profile, it was just we had to correct those, bring those hormones into imbalance. How long it took before we were able to get you balanced and you were able to conceive?
It was 2 years, actually. We first we had to balance all the hormones, and I got into the routines with the breathing and yoga and a new diet, and started eating organic as you recommended and more whole foods. And I think the whole thing together, in fact, when I got pregnant and went to the OB gynecologist, she clearly said that had I not been seeing you and been following your instructions on all of these items, that I would not have conceived. So it was a big life changer.
Right. It's like it's a good teamwork. Every time when patients walks in, I tell them I can be your mentor and guide. I will guide you as long the patient follows. So you were a good follower. So you did listen to all the directions and you followed the exactly. So that really helps, because it's not I tell them that pills and medicine is not there to do anything unless you are able to follow the other guidelines. It's a multifactorial because lifestyle have to change. The stress factors have to come down. We need to create that harmony within ourselves so your body says, I'm ready to conceive now. So that's exactly what happened with you when we corrected all the hormonal and the nutritional factors taken care and you were able to conceive. So I really thank you and congratulate you and thanks for calling us and talking to us on our show.
Yes, thank you so much.
Thank you. And here is caller number 2. Caller, go ahead. This is Dr. Shailinder Sodhi on your show, Your Body is Your Natural Pharmacy. And go ahead. Hello, caller. Are you online? Okay, we will try again one more time. Caller, go ahead. You are on a line with Dr. Shailinder Sodhi.
Hi, doctors. Can you hear me?
Yes, now I can hear you. Go ahead.
Awesome. I wanted to call and check about what is your advice on what kind of lifestyle changes and what kind of dietary changes should be made for somebody who has PCOS?
It's a very good question. Like we started with Dr. Anju was saying, the PCOS is we are hearing more and more. People are getting more aware of polycystic ovarian syndrome, which it stands for, and it the autoimmune. The main thing with the PCOS, caller, is that we usually recommend that having clean diet.
Very important. I have noticed like people are eating with my PCOS, mostly the young girls, they are not eating well. They are eating a lot of fast food and not the whole grains or the whole food. So we need to correct that. That is the first thing.
Right. And one of the things which in the PCOS is we also want to make sure there's a balance between estrogens and progesterone.
Because if they are eating a lot of like the chicken or like the beef or like that type of meats more, and the more like if they are cooking at home, if they are eating the organic like the homemade, that is still better. But if they are eating like the fried foods or on the fast food restaurants, that's not going to help.
And I see that even in my vegetarian population who have diagnosed with PCOS, those who never eaten a meat products, still they have PCOS because they are eating the food which is not organic
and not clean and the pesticides.
And so eating the pesticide-free food is very important. And sometimes I tell my patients, if you have a small yard in the back, grow your own vegetables. Make a small greenhouse. It doesn't take a whole lot of effort. Try to have a green thumb. It's really helpful. You put your energy into these vegetables and they grow nicely, and that brings the positivity in your body. So eating clean is very important. And the second thing is then we want to also make sure that the organs, the ovaries and uterus and all these are healthy as well. Adrenal glands need to be healthy. The stress factors need to be brought down. So the diet factor and the supplemental factor need to be really taken care in the.
Yes, of course. So like many times, like a lot of the Ayurvedic supplements, the aloe vera juice is great too for the women too. And there is the Ashoka Risht, and those are the supplements we have as the whole line too for the women to balance the hormones too. So that need to be given as well to correct the hormonal imbalance.
And caller, the other thing which we in the PCOS it is important is to making sure that the breathing exercise, the pranayama, and all those have a rejuvenating effect on, and it has an effect on balancing out. So, those are such an important breathing. I tell the breathing, you do breathe anyway.
But we are very shallow breathers these days.
Exactly. Learn to breathe deeply and learn to do, pranayama breathings. Those are such important yogic breathing that it creates a greater balance. I say it creates a balance of all the 7 chakras. So when we're talking about PCOS, it is an imbalance in the Mooladhara chakra, which is the base chakra. So we usually balance that out by doing the breathing exercise. So that is really important. And also making sure that, you give enough time to yourself. So that is important. Otherwise, it is one of those things, catch-22. You have a stressful event, you work all day, you come home and not able to cook your food properly and not able to have a good relationship with your spouse. these are the factors which will affect the PCOS even worsely. So I hear a little baby behind. So you have a little one baby as well?
Yes, she just turned 3 months old.
Okay, congratulations. And we thank you for calling us, and you take care. And do you have any other question?
No, thanks, doctor. This is nice talking to you.
Thank you. So, one of the things which I'm telling our listeners is the diet and lifestyle factors are very important when we're discussing the infertility. We'll be coming back short after the breaks, folks, and feel free to call us at 1-844-301-1250.
Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022.
Thank you, folks. This is Dr. Shailinder Sodhi on the show Your Body is Your Natural Pharmacy. And today we are discussing infertility. And when we were discussing infertility, there is a component which goes with the men's health as well. I'm going to take a little bit step toward the men's health when we are discussing infertility. Like I said, 13 people out of 100, men suffer with the infertility issues. Usually, there are factors which are affecting the men's ability to have a baby with their spouse. The reasons are usually, sometimes it's a mechanical reason, sometimes it's just genetic issues where they don't have. So some people, in our clientele, I find majority of men, those who are working overtime, working really high stress job, are actually having lower count of sperms. So, the oligospermia is a terminology which gets used in this case. That means the number of sperms are lesser in the amount. So, that's one of the reasons we say, okay, that's one probably reason you are not able to get your wife pregnant. But sometimes there is there is anatomical reasons. There could be issues going on with the vas deferens, which is the things, it's a tubules type of structures which links, and then there is there can be issues with the testes as well, and sometimes it's just a hormonal issue, the testosterone issue in the men. And these days we are finding a lot more younger population are having lesser testosterone in their body, which actually, tell you the truth, needed for the testes to produce the sperms. So, there is a whole physiological factors which needed in the men to make sure that they are able to have healthy counts of sperms. So, the one thing which also affects in men's health when we're talking about infertility is the, some type of inflammatory diseases, the pelvic infection, the sexually transmitted diseases also cut down the sperm counts, or sometimes it just interfere with it. So even though when we talk about the low sperm count, we also need to make sure the men have to be really ready with the healthy diet, lifestyle, and healthy diet and healthy exercise routine. Men must be doing exercise. More exercise you do, more testosterone you build. And like I mentioned earlier, testosterone is needed for the testes to keep on the production of the sperms. And that is good. And also making sure the health of prostate need to be in good shape as well. The prostate health is also important because it also is needed because it brings the alkalinity to the whole semen. So prostate health, testis health, and as well as exercising routinely will increase the chances of getting the sperm count up. In some individuals, we find where there is issues where they don't have, the testes just cannot produce enough sperm, and those are the cases which are tough. And sometimes you may have to go with the mainstream where the biopsies are done from the testes to extract out the sperms and try to do IVFs. In that case, so those are the extreme cases. In majority of my population, which I see, I'm able to help my population in the men's by increasing the testosterone with just simply modifying their diet, doing much more holistic diet, wholesome diet, and adding the supplements important, like zinc is important supplement for the men, and I recommend all the men should be taking certain amount of zinc in every day. If you don't take a pill, if you don't like to take a pill, the zinc-rich foods are like pumpkins, seeds. Those are very important to have every day. Eat some nuts and seeds are very important. And healthy fats. Remember, the fats are important. Fats are not bad. Fats play a major role. They are the part of our steroidal structure in our body. And fats are the one which get converted in for the hormones. So guys, if you are having an issues and you finding that the sperm counts are low or down, need to pay attention to these certain things. So get active, do more exercise, do more yoga. And while I've discussed this, Dr. Anju, what do you recommend to the women when it comes to the diet?
I do suggest them because if women are eating a lot of the spicy food, lot of fried food, these type of foods not going to help them. So avoiding those foods would be very beneficial too. And as you said, the wholesome foods would be great. And eating the nuts and seeds, the fresh vegetables, whole grains, some dairy products, but not a whole lot.
Right, all this the fresh foods and which we're talking about, which have a natural antioxidants. And these days in the summer and spring, we are so lucky to have so many berries available to us. They are loaded with antioxidants.
And also in the spices too, the fenugreek has effect on the ovulation too. So using the fenugreek, and in Indian population, people do use the fenugreek a lot too. And the cumin seeds are great too. That helps with the ovulation too. And also same time, the quinoa is great for the both men and women to increase the balance the hormones
and
too.
I find it is more and more available these days in the stores.
And people are aware too.
Right, and some of those our population, those who have not heard of the grain quinoa, it's a very nice grain which actually cooks like rice.
Yes.
And it's easy to cook.
Same as you cook the rice, you can cook the same way.
Right, and it is loaded with the minerals and nutrients.
It is loaded with the minerals, and for the vegetarian population, it has a lot of proteins too. And cook it with little bit of the ghee and some spices like the cumin and the ginger. It would be very beneficial.
Right, ghee is actually in Ayurveda is considered as a spermatogenic. That means it helps to increase the load of sperms. So people usually, those who are kind of thinking that ghee is bad, actually it is not bad. It's a very good fat, as long it comes from the organic butter. You need to have organic ghee rather than the ghee which is coming from the not organic.
Yes, and instead of if you feel buying ghee from the Indian grocery store, if it's not organic, you can make your own. You can buy the organic butter, and actually you can buy organic cultured butter too, and you can make ghee at home.
Right. So, it's eating a lot of organic foods and, making sure if you use dairy, and dairy need to be organic as well.
Dairy has to be organic. Otherwise, there is already the hormonal issue going on. If we are not eating organic, we are doing more damage to our system.
Right. And the other thing is also trying to eat, like you mentioned, cold water fish.
Cold water fish, yes. Salmon is very great, like the wild fish. It has to be wild. And
I usually recommend Alaskan salmon,
very
which
good.
is a fairly very clean water. We still have a little bit clean water left in that part of the world.
Yeah. And for the people who eats like some, like the chicken, organic chicken can be eaten too.
Yeah.
But like for the vegetarians too, it's like there is like the nuts and seeds. The amaranth is a great like the grain too, which has like a lot of protein and amino acids too as well. So that is great, and the quinoa is great. And I do suggest my patients go for a gluten-free diet for some time. And when we are doing the cleansing, when we are trying to cleanse the body, so gluten has to be off, dairy has to be off. And that really helps too. And the clean diet, more like the sometimes like just on the oleation and the khichdi on the one diet, like that, just to clean the body too, also helps.
And sometimes people ask me why we keep pushing for the wild salmon or wild halibut. My usually the farmed salmon is usually has lots of antibiotic, and sometimes they add dyes to give the color. So that's the only reason, folks, why we do not recommend farmed fish. So anyway, we'll be right back after the breaks. Please stay in tune, and we'll be back.
If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022.
Hello, folks. This is Dr. Shailinder Sodhi along with Dr. Anju Sodhi, and we both practice at Ayurvedic Naturopathic Medical Clinic in Bellevue, and we have been there for over 25 years in this location, and we both have been seeing patients. Our clinic is very much specialized with Ayurvedic treatments and naturopathic treatment. We see all kind of patients, and one of the topic which we have chose today to discuss with all of you was infertility. And like we mentioned, when we're discussing infertility, the one of the things which is very important for the listeners or those couples who want to have a baby in their life is to make sure that they are very healthy. And it is healthy at the mental level, emotional level, at physical level.
Yeah, spiritual level is as important as the emotional, and spiritual level is as important as the physical level is.
In the physical levels, when we have mentioned, like, there could be damage to the fallopian tubes because of the pelvic infections or endometriosis or the pelvic surgeries, or could be hormonal causes, sometime the ovulation is not in sync, or sometime just the body does not have good level of progesterones or estrogens in the body, and sometimes it could be as simple as a cervical issues, which is a part of the uterine apparatus, that these people can have an issue where the sperms cannot pass through the cervix. And sometimes it's the uterine causes, which has abnormal anatomy, which, like Dr. Anju mentioned, can be fibroids or endometriosis or endometrioma, or the polyps, which can interfere with the traveling of the sperm to the egg. And some, other times, like I mentioned, 20% of the time, it's unexplained,
Yes.
which is where I come in, that where I like to see the couples. And what do you have to say, Dr. Anju?
Yeah, definitely has to be on the, like we said, the mental, emotional level. It has to be balanced as for the physical level too. So I do recommend some of my patients, if they are having, if I feel that type of issue is going on too, then like I do the marriage counseling. So they should see a counselor too, if we alone are not able to help them a lot with that. So that we can take that help as well too.
Right. Like I said, having harmonious relationship is very important in the couples. And if there are issues which are not resolved at different levels, then, that will definitely interfere with the, body. Just say, physically or mental and emotional level, we are not accepting why I should be conceiving a baby.
Yes. So also I would like to add some foods to enhance the reproductive system. And like we talked about the quinoa, which is great. Also in the vegetables, like the asparagus is great. Broccoli can be taken, and the dates are great too for the both men and women if they are planning to get pregnant. Women is planning to get pregnant.
Right. I find that dates are really rich in lots of minerals.
Yes.
And, along with a little bit of saffron stigma, which gives the beta carotenes, it's a very good source of energy for the body and antioxidant. It gives all the minerals which needed, like which we mentioned earlier. They're important.
Yes.
And for those people who are not vegetarian, who do eat non-veg, the seafood, oysters and salmon and halibut, these type of fish are very good as well.
So same time, like in the spices, like I mentioned, cumin is great too, and the turmeric powder. Indian population, they eat a lot, but it has to be increased. Also, like the ajwain or the anise seeds are great too, along with the cumin too. So that helps to purify the uterus in the women as well. So anything else, Dr. Shailinder, you want to add?
I think one of the things which might come to our listeners is, how do you diagnose, what type of the diagnostic tests are helpful in detecting if there is something going on with the tubal obstructions in the fallopian. And, the simple ultrasound is sometimes we do to see the health, to see if there is anything going on with the ovaries or the fallopian tubes or the uterus. Looking for the fibroids or the cyst, and sometimes just doing a pelvic examination and checkups by the physicians to make sure the structure looks normal. For mainstream, there is one of the tests which tells the patency of the fallopian tube is called hysterosalpingogram. It's a procedure which involves either with the X-rays or ultrasound, that where we are looking at the reproductive organs. So there is usually what we do in hysterosalpingogram is that either a dye or normal saline or air is injected through the cervix and then scanned through the ultrasound to see if the fallopian tubes looks good. And then there is other ways, the laparoscopic study, which is a little bit of surgical procedure, small incision given below the belly, and it looks at the outside of the structure of the uterus, ovaries, and eggs to see if there is any, scarring or anything which looks maybe interfering. And these are some of the tests which can be done. And other tests which we do are the blood.
Blood test we do for to check the hormones and stuff. So that also the thyroid is very important too. If the people, if somebody has, like either in the men or women, if they are hypothyroid, that also need to be corrected. And also sometimes women comes to me if they already have been through the IVF, and so in that case, if I'm doing the treatment, it's very important to do the cleansing program first. So which is the Panchkarma, which is a detox program. It has the massage and the steam sauna and the fasting and the purging and the colonics. That is on the cleansing on the more deep tissue cleansing. So it's more on the deeper level.
Right. And the folks, when we are discussing infertility, it's a very complex issue. It's a very complex topic. So, it has to be dealt on different levels. Every individual is different, and not every couple can be treated the same way. At our clinic, we are very much specialized in treating, and I'm happy to report my success rate is above 90% in my infertility patients in infertility clinics. And when you plan to come, it is a time consuming. It's can be stressful at times, And having, coming to our clinic is important, and having an important discussion with us and understanding what we are going to achieve during that.
And the clinic number is 425-453-8022. And we are like the Monday to Friday available over there.
Right. So our clinic is in Bellevue, Ayurvedic Naturopathic Medical Clinic. And it is, like Dr. Anju said, the clinic phone number is 425-453-8022. And, we treat all kind of patients. So we not only do infertility, but we also have cancer patients who comes in and other patients as well. So, folks, this ends up the show for today, and it wraps up. And thank you for calling us and listening to us. We'll be back.